Hello, my name is Roshni, and today me along with my group from allocation number 25 are going to present about Atorvastatin, a drug that is listed second highest among the total volume prescription drug from the year 2017 to 2018 under PBS. In this presentation, each of our teammates are going to talk something about Atorvastatin that is going to give you an insight about the medication. Here's a brief overview about atorvastatin. Atorvastatin is the most common medication which is widely used to prevent cardiovascular events and for the patients with abnormal lipid profiles. It is often known by the brand name Lipitor and belongs to class hydroxymethylglycerol coenzyme A reductase inhibitor that works by inhibiting hydroxymethylglycerol coenzyme A reductase in liver, which reduces the level of cholesterol at the initial stage. This class is often referred as statins and is prescribed for elevated low-density lipoprotein cholesterol and to reduce the risk of cardiovascular diseases. Atorvastatin is even listed as a drug with second highest total prescription volume in year 2017 to 2018 under PBS.
Pharmacokinetics. Absorption. Lipitor is rapidly absorbed after oral administration, and the maximum plasma concentration occurs within 1 to 2 hours. Over 98% of the administered drug can be found in a bound form with proteins. The rate of absorption is directly proportional to the dose that is given. Food, however, will decrease the rate by 25%. Distribution. The mean volume of Lipitor that is distributed is about 381 liters. It binds to plasma proteins and travels in the circulatory system. Also, Lipitor is very likely to be secreted in human milk according to research. Hence, it is the reason why women that are pregnant or that are breastfeeding cannot take this drug. Metabolism. Lipitor is highly metabolized to ortho and para-hydroxylated derivatives, primarily by cytochrome in the intestine and the liver, which is then further lactonized. The oral bioavailability of atorvastatin is 14%. Excretion. Lipitor and its metabolites are eliminated mainly in bile after metabolism in the liver occurs. The half-life of Lipitor is approximately 14 hours. An interesting fact is that in urine, less than 2% of Lipitor is actually recovered following oral administration of the drug.
Affinity of atorvastatin. The core structure of atorvastatin includes the polar group that imitates the natural substrates, together with an extensive hydrophobic group that binds strongly with the hydrophobic binding region of the enzyme. Atorvastatin inhibites with the enzyme HMG-CoA reductase. The dominant contributions of binding of the atorvastatin is entropy change at 25 degrees Celsius. In the binding of atorvastatin, the carbonyl group of amide group provide an additional hydrogen bonding locus. Mechanism of atorvastatin. Atorvastatin is an oral antilipemic agent that inhibits the HMG-CoA reductase. Atorvastatin and its metabolites are responsible for the pharmacological activity in the human. The liver is its primary site of action and the principal site of cholesterol synthesis and LDL clearance. HMG-CoA reductase catalyze the conversion of HMG-CoA to mevalonic acid. That is also the rate-limiting step in the hepatic cholesterol biosynthesis. Inhibitions of the enzyme lower the cholesterol synthesis by increasing the expression of low-density lipoprotein receptor on hepatocytes. This increases the LDL uptake by the hepatocytes, decreasing the amount of LDL cholesterol in the blood.
Efficacy of atorvastatin. Atorvastatin is effective in treating plasma LDL cholesterol and total cholesterol. It improves body's ability to get rid of LDL cholesterol through the liver. According to the research in various groups of hyperlipidemic patients, it showed reduction of LDL cholesterol by up to 60% and triglyceride by up to 50%. Evidence has shown that even for low-risk individuals with less than 10% of major vascular event occurring within 5 years, atorvastatin causes a 20 to 22% relative reduction in major cardiovascular event for every 1 millimole per liter reduction in LDL without any significant side effects.
According to the standard for the uniform scheduling of medicines and poisons, atorvastatin is scheduled as Schedule 4 drug, which is a prescription-only medicine. This drug can only be prescribed by a medical practitioner or a nursing practitioner. Apart from them, a group of interprofessional healthcare team work in a coordinated manner to optimize atorvastatin therapy. The pharmacist or a medical practitioner can only dispense this medication after a valid prescription has been prescribed. Similarly, the nurses and doctors counsel the patient for the ways to take medication and monitor its effect. Moreover, the pharmacist even counsel the patients regarding the optimal dosing, for example, the time to take the medication. The nurses can administer the atorvastatin to the patient with or without food. However, it needs to be the same time every day. This drug has been listed as a registered medication by TGA and is assessed for safety, quality, and efficacy. It also falls under restricted benefits.
Atorvastatin is used to lower cholesterol level. It comes in oral tablet and is found as 10, 20, 40 and 80 mg dose. This medication can be taken with or without food but needs to be same time every day. The most common side effects of atorvastatin include constipation, heartburn, headache, mild muscle pain, diarrhea, nausea, and fatigueness. However, the doctor needs to be contacted in the case of serious side effects such as muscle breakdown, confusion or memory problems, fever, dark urine, increased thirst or hunger.
Certain diet plans need to be considered during intake of atorvastatin. The patient needs to follow a strict diet plan as prescribed by the doctor and needs to be on low cholesterol diet. Moreover, the patient needs to limit their alcohol intake and needs to avoid foods like grapefruits. In addition to that, antacid medicines and macrolide ABX needs to be avoided while they are charted on atorvastatin.
Precautions. Before taking atorvastatin, a doctor has to be consulted, especially if the patient has one of the following conditions: liver disease, muscle pain or weakness, a history of liver damage, kidney disease, stroke or thyroid disorder, and pregnancy.